So a patient having brain tumor, how do we know that somebody has? We can't see directly. So there are certain symptoms or the warning signs which you can observe in a patient having brain tumor. As they slowly grow in size, slowly we see these symptoms gradually increase or aggravate. In the early stage, definitely we can't see any symptoms. Most of the times, these people are asymptomatic. So most common complaints are headaches. Either they start newly or they might be different from the regular headaches what they are getting, and sometimes they keep on worsening over time, and sometimes they change with the way they are like sleeping or waking up, etc. Sometimes they become more worse, and when they awake, and suddenly they start improving. And the other things include personality changes. If the tumor is in the frontal lobes or the places where our brain controls our personality, like thought, judgment, ability, different things, all these things in this area, then definitely there is chance of personality change. And the other common symptom that we see is nausea or the vomiting. Like the patient might be feeling like they are about to vomit off, but most of the times they won't, and they have this constant feeling of vomiting. And if the tumor is near the occipital areas or the areas nearby the visual tracts, they may have blurred vision or papilledema or sometimes double vision. And seizures, the other component, sometimes they occur in the places where there is high propensity of causing seizures, like motor cortex, sensory areas, premotor cortex, etc. And the chances of these causing seizures is very common. And in fact, most of the times people come with some kind of fits, seizures, to the hospital, and on evaluation they suddenly find that there is something, a mass occupying in the brain, and on further evaluation they might find out it is a tumor. And the other common symptom we see is the cognitive changes. The other changes that depend on location of the tumor, like every part of our brain controls some kind of activity, what we do or what we perceive. So site specific, that if the tumor is in certain part only and is not spreading to other parts, only we see that symptoms which are related to that site. So, for example, it is in the frontal lobe. You can see personality differences, cognitive effect, expression, language, slurred speech, etc. And if it is in temporal lobe, that is in the on the lateral side, definitely our speech, receptors, and also hearing, all these things are in that area. So they definitely get affected. And if they are in the upper central parietal areas, there will be chance of affecting the coordination. So patient might be having weaker in coordination, etc. If the tumor is in the back of the brain, that is where we have our optical tracts, etc., and the center for our vision. So the patient may present with blurred vision, double vision, or any other things related to the vision. And if a tumor affects the cerebellum, that is the small brain, what we call, is below this cerebrum. And in this part, if there is a tumor, the person may have incoordination, balance problems, like he may not be able to walk steadily, and he may not be able to walk with closed eyes. There will be a problem with stereotaxy and incoordination. So most of the times these symptoms may mimic like a stroke, but they are not. So people might think there might be a stroke and suddenly come up to the hospitals, and they will find out there is a tumor. So what do we have? Like, what are our options? How do we treat, or you want to evaluate? So if they are like very small benign brain tumors, there is an option of serial MRI scans and close surveillance if they are not causing any symptoms and they are benign looking. So you can closely watch it, and if there are any signs of any symptoms, or if it is growing in size or it is causing any mass effect, definitely you have to go for active treatments. So what active treatments do we have to treat brain tumors? So these all are the available active treatments to treat brain tumor. One is the brain surgery, the other is the radiation therapy or radiosurgery, chemotherapy, targeted therapy, and tumor treatment fields. And these tumor treatment fields are the latest evolving techniques and still not been into the regular practice. and has been practiced only in few places. Okay, so if there is a tumor, the primary aim of treating any brain tumor is whether you can completely remove it or not. If you can remove it, the chance of cure is very good. If you are not able to remove it, is there any chance that you can remove maximum portion of it so that the symptoms will be immediately alleviated, and the rest of the part which has been left out can be taken care by the adjuvant treatments like radiation or chemo. And also it also depends on the position, location, and uh, in the vicinity of the critical structures. So even if it is in the critical structures, you may not be able to do a bigger surgery. You may go for a biopsy to confirm whether it is a tumor or not. So biopsy helps in diagnosing the tumor. And if you are able to resect it, the resection can help you in the diagnosis of the tumor as well as remove as much as tumor as possible. So we are talking now about surgery. So surgery, it depends on what position it is, where is the tumor, and you cannot access the brain directly. It is inside the cranium, so you have a lot of bony vault around it. So it also matters how can you approach it, what bones are in the way of it, and how much part of the brain is involved. So you can directly pierce off brain from anywhere and without causing any functional problems. So this is a very critical thing to be planned before finding the way in the surgical approach. And also what are the arteries and veins involved. So all these points are taken in coordination and can be planned what is the easiest, safest way to do the effective surgery. So here you can see there is a tumor in the medial side of the one lobe of the cerebrum. So you can either approach from side or you can approach from above. But if you are trying to approach it from the sides, one is the lateral side, you have to pierce to the bone and you have to pierce to all the brain tissue until you reach the tumor. So is it a good thing? No, because you are going to damage a lot of normal functioning brain. So the ideal approach would be to find a way where there is a least possible brain tissue, that is from the top. You can see there is a chance that you can approach to this meninges, and the chance that you can damage the brain tissue is very less. So this is the way you have to plan a brain surgery. So other approaches include when they are in the ventricles or near the base of the skull. I can see here there is a lesion in the base of the skull. The easiest way is we have through the nasal canal. You can go through the nasal endoscopic approach like this. So this is called a transnasal or transsphenoidal approach. This way you are not going to damage much of the brain. So here you can see a lesion almost near to the cranium. So it's easy to do a craniotomy and to do it. But is it nearby any functional area? Yes, there is a chance that you are going to damage the motor cortex. So the thing is they will be doing a away craniotomy so that they will be knowing which areas they are touching, whether they are damaging the motor cortex or not. So with this guidance, they will be carefully doing the surgery. So there are different approaches in doing a brain surgery. So if the tumor is very deep seated and it is in the critical structures, like you can see in the brainstem or nearby to it, the chance of causing high morbidity or mortality, that is causing death, is more. You don't do it surgery, you can go for a biopsy. So in biopsy, you will be using a simple needle and approaching towards the tumor, and you will be simply picking small tissues to confirm what type of histology it is and what type of tumor it is. So to aid all these things, we have microscopic surgical tools, which improves the visualization, increases light and magnification so that the surgeon can clearly distinguish between the normal tissues as well as the tumor. And this improves the surgeon comfort as well as they can adjust the scope angles and to see which area to approach and how to dissect the entire tumor. Other advancements in biopsy as well as neurosurgery are navigational biopsies and neuro navigation systems, which help them to three-dimensionally map the path where they are approaching and how to approach the tumor and where to do the resection. And also they will be able to get the radiology data. And also now we are able to fuse the functional MRIs with the way they are going to do the surgeries. And this also helps a lot in not damaging the functional parts and approaching the tumor. And another advancement in the surgical part is the robotics. Navigation systems associated with the robotic surgery is another innovation, and this helps in doing fine movements and utilize the robot alien the instruments in very precise way so that they can do the surgery with more accuracy and more precision. And the benefit of this type of surgeries is you are going through a very pinhole surgery and the incision is very small and the precision is very high. So the recovery period is very less. So another thing is laser ablation. If the tumors are very small, like around 2 to 3 centimeters, if they are approachable, there is a chance that you can directly put a ablative needle inside the tumor and do a laser ablation or micro ablation or radio frequency ablations. And this way they can burn out the tumor inside itself without doing a surgery. But the disadvantages of this process is it cannot be used for bigger tumors more than 2.5 to 3 centimeters because the effectiveness drops down after this kind of diameter. And also the problem is you have to pierce through a lot of brain tissue before approaching it. If it is deeper, the more you are causing the morbidity.